Non-steroidal anti-inflammatory drugs. Not as harmless as you would like to believe. Let's check this out. Every day, more than 30 million people take over-the-counter and prescription NSAIDs for pain relief, headaches, and arthritis. Currently, there are about 20 NSAIDs available by prescription only. Examples would include drugs like ibuprofen, naproxen, aspirin, and ketoprofen. Now we go on in this report published by the American Gastroenterological Association. These drugs are responsible for severe and potentially deadly gastrointestinal problems. Each year, the side effects of long-term NSAID use cause nearly 103,000 hospitalizations and 16,500 deaths. Let's just pause right there for just a minute. 103,000 hospitalizations and 16,500 deaths for properly prescribed drugs to block minor aches and pains. Now, they go on to say 71% of those who were exposed to NSAIDs for more than 90 days had visible injury to their small intestine. Injury in these people ranged from small erosions to severe ulcers. Some symptoms of dyspepsia or indigestion associated with NSAID use are common in those who use these drugs long term. And the problem with that is when people develop indigestion from the use of these pain blocking medications, oftentimes they get placed on drugs to block stomach acid. And so then we begin kind of the never-ending, use a drug to treat a drug component. But back to NSAIDs. Check out this study. Chronic NSAID use increases the risk of peptic ulcer disease, acute renal failure, and stroke/myocardial infarction. Again, not just stomach damage or intestinal damage. We're talking here kidney damage, the risk of stroke, and myocardial damage. They go on to say chronic NSAID use can exacerbate a number of chronic diseases, including heart failure and hypertension, and can interact with a number of other drugs. Now, aside from that, so aside from increasing your risk of stroke, increasing your risk of kidney damage, non-steroidal anti-inflammatories can also interfere with vitamins and minerals. So the big classes of nutrients impacted by this style of medication, number one are B vitamins. They're known to cause B vitamin metabolism problems and deficiency. Number two, we see iron deficiency as a result of the bleeding that these drugs cause. Remember, they're not benign. They cause intestinal damage that leads to chronic blood loss through the GI tract. And number three, vitamin C deficiency. So let's dive in. Check out this research study recently published on the clinical use of COX inhibitors impairing vitamin B6 metabolism. And the conclusion of this study was, to our knowledge, we show novel findings that long-term physiologic doses of COX inhibitors, by the way, COX inhibitors are non-steroidal anti-inflammatory drugs, may impede the synthesis of the coenzymatically active form of vitamin B6. Because the cause of vitamin B6 depletion and inflammation remains unknown, this study provides a potential mechanism that could account for the poor vitamin B6 status in human inflammation. Moreover, this study further raises concerns about the long-term clinical use of anti-inflammatory NSAIDs in humans. Vitamin B6 status should be carefully monitored in long-term NSAID users. So again, the synopsis of this research study is vitamin B6 deficiency as a consequence of long-term NSAID use, and that doctors prescribing these NSAIDs should be monitoring their patients' vitamin B6 levels. Now look at this other study, the association of aspirin use with vitamin B12 deficiency. And so you can see the conclusion here. In almost half of the study population, vitamin B12 deficiency was found. Patients using acetylsalicylic acid, which is aspirin, were more frequently vitamin B12 deficient in comparison to non-users, with a p-value of 0.02, which basically means this is a very, very accurate study. And so the conclusion being that B12 deficiency is more common in chronic aspirin users than not. Why is that a problem? B12 deficiency by itself can cause chronic pain. It's actually one of the causes of chronic pain. So you treat chronic pain with a drug that can cause chronic pain, and you end up chasing your tail. Now check out this other study, B vitamins and non-steroidal anti-inflammatory drugs. And so in this study, the authors state B vitamins, including thiamine and pyridoxine and cyanocobalamin, that's B1, B6, and B12, can be considered as adjuvant analgesics in non-specific back pain. So basically what they're saying is that if you use B vitamins can actually be used to treat non-specific back pain. The results of animal experimental studies have shown that B vitamins at high doses have analgesic and anti-inflammatory effects. Now, they go on to state the addition of B vitamins to people taking NSAIDs. In other words, add B vitamins. If you're taking ibuprofen, let's throw in some B vitamins to that mix, because that can reduce the duration of treatment by 2 times. In other words, one of the key factors if you're using an NSAID is the longer you're on it, the greater the risk of damage. Now, what this study is showing is that you can reduce the risk by, or the need for the medicine by half if you take it with B vitamins. Now they go on to say by reducing the duration of pharmacotherapy or drug treatment, the risk of adverse reactions to NSAIDs decreases and the patients return to daily activities more quickly. So why the heck not? Add a B vitamin, add a B complex. You take an ibuprofen, put some B complex in the mix, and you're going to reduce the downtime, and you're going to increase basically the efficacy, because the combination has been shown in research to work better. So check out this conclusion. In older people with mild cognitive impairment, B vitamins had significantly favorable effects on global cognitive functioning and whole brain atrophy rate in those who were not taking aspirin, but not an aspirin users. In other words, the elderly who were struggling with cognitive decline, when they took B vitamins, they had improvement unless they were taking aspirin. And so this just ties back into the theme of today, which is non-steroidal anti-inflammatories, including aspirin, can interfere with B vitamin uptake utilization by the body. And we need these B vitamins. Remember, your brain is an energy hog. It needs tons of energy, and the way we make energy from the food that we eat is through the chemical reaction of B vitamins. So when you're taking medicines that interfere with the function of these B vitamins, you're setting yourself up for failure. And in this case, in this study, cognitive decline. And you see in this next research study published in Nature Reviews Nephrology, non-steroidal anti-inflammatories increase the risk of iron deficiency in hemodialysis patients. And so the authors in this study conclude that the use of these drugs increase iron loss. And one of the ways that iron is lost is because these drugs actually do damage, mucosal damage to the small intestine, and that leads to bleeding, actually microscopic bleeding in the intestine. This is one of the tests that doctors oftentimes run. It's called an occult blood loss test, and that's done through the stool. And what that sometimes helps us understand is whether or not a person is losing blood because of intestinal damage. So if you're taking long-term non-steroidal anti-inflammatories, you might want to ask your doctor to test you for occult blood loss in your stool, lest you develop an anemia as a result of that use of that medication. Now check out this next research study. We've got a lot of studies for you today on vitamin C and aspirin interactions. And so again, paraphrasing here the abstract from the study, vitamin C associated increases, however, they appeared to be blocked when the vitamin was given simultaneously with aspirin. What that means is aspirin actually was shown in this study to block the uptake of vitamin C into tissues. And one of the tissues that we know aspirin can inhibit uptake of vitamin C into is your white blood cells. And why is that important? How many of you have ever taken aspirin to reduce a fever when you were sick? Well, this very drug can actually cause a reduction of uptake of vitamin C into your white blood cells, and your white blood cells need that vitamin C to help fight that illness. And so again, if you're using aspirin as an anti-fever agent, you're inhibiting vitamin C uptake into your immune cells. Now, to go on with this, you can see here, vitamin C was found to be significantly increased in the stool when the vitamin was administered together with aspirin. In other words, aspirin creating increased excretion of vitamin C. These results suggest that aspirin may impede gastrointestinal absorption of vitamin C. And this hypothesis has been strengthened with in vivo studies as well, or in vitro studies as well. So this is not the first time we've seen this. There's a long history of aspirin-induced vitamin C deficiency that goes back over 50 years. And look, here's just one more thing to consider about vitamin C. Check out this research study published in 2017 on the role of vitamin C in the treatment of pain. You see here, vitamin C deficiency disease, scurvy, is characterized by musculoskeletal pain, and recent evidence has indicated an association between suboptimal vitamin C status and spinal pain. Furthermore, accumulating evidence indicates that vitamin C administration can exhibit analgesic properties in some clinical conditions. The prevalence of hypovitaminosis C, in other words, low vitamin C, and vitamin C deficiency is high in various patient groups such as surgical trauma, infections, and cancer patients. A number of recent clinical studies have shown that vitamin C administration to patients with chronic regional pain syndrome, sometimes also referred to as reflex sympathetic dystrophy, decreases their symptoms. We also see acute herpetic and post-herpetic neuralgia. So those of you who've had recently had shingles, which is a form of neuralgia, is also diminished with high doses of vitamin C administration. So they go on to say, overall, vitamin C appears to be a safe and effective adjunctive therapy for acute and chronic pain relief in specific patient groups. Again, vitamin C to treat pain. NSAIDs to treat pain. NSAIDs cause vitamin C deficiency, making you more susceptible to pain syndrome. So again, chasing the tail, we want to stop that from happening, and we want to make sure that you understand it. Now, what would I recommend for many that are trying to deal with, chronic pain? What's a better solution? Aside from nutraceuticals, aside from things like vitamin C being very supportive of pain and omega-3 fatty acid fish oils, one of my favorite is white willow bark. And white willow bark is the plant that aspirin is synthetically derived from. But white willow bark can be taken and it doesn't seem to have the effects that aspirin and other NSAIDs have, which is destruction of mucosal tissue and erosion and the interference and interaction with vitamins and minerals. So white willow may be a great solution for you if you're looking for something natural to support yourself. Again, if we summarize, if you're using a medicine like ibuprofen or aspirin to block pain or to thin your blood, you should be aware that the consequences, not only can they damage your kidneys, increase your risk of a myocardial problem and stroke, but they can cause vitamin and mineral deficiencies that can lead to further deterioration. And keep in mind too that we need B vitamins and we need vitamin C to make collagen and to make cartilage. And so if you're taking these drugs for pain, for joint pain specifically, you end up inhibiting cartilage synthesis, which is the very thing that your body needs to be able to do to heal and repair you. So in that regard, be warned. If you're taking these medications, it's maybe a good idea to have this conversation with your prescribing doctor to see if not taking these medicines is right for you.